Hi everybody, my name is Ildikonyari and this is an information about the coronavirus COVID-19. So the first slide is the difference between endemic, epidemic, pandemic and endemic. The coronavirus started as an outbreak, which is inevitable. It started in China in 2019, and when you fail to control that, then it became an epidemic. When you fail to control the epidemic, it becomes a pandemic, which is right now what we are experiencing in the US. It means that it crosses continents, it looks like a social collapse, and when you fail to control that, then it becomes an endemic. So the virus is not eradicated and becomes seasonal. So the next slide is a walk-in tent in Brooklyn, but there are many all over the US. The problem is that they still don't have sufficient testing kits. This particular example is in Brooklyn, where you can just walk in and they will test you. Okay, so the next slide gives some information about that. When you walk into the tent and you don't find anybody at the time when you just walk in, then you can go to the entrance of the building and ask the guard to send the doctor down, because the doctors will not sit and wait there 24/7. Or if they don't have testing kits available, then they will ask you to schedule an appointment. Okay, so the next slide is basically about the building. That this building is used for offices, medical centers, and one of them is the Carco Medical Center, who is offering this test, and the Quality First Urgent Care, the Brooklyn Surgery Center, Maimonides Bund and Jones Center, and many other tenants also. These doctors are Doctors on Call affiliates. Okay, so now I will talk about how the coronavirus survives on surfaces. Mainly it spreads through droplets. However, this is a very contagious virus and it can survive on surfaces. So the first is the air. The coronavirus survives in the air up to 3 hours, which means that you should open the windows and make a crosswind to change the air to avoid the concentration of particles. And then it also survives on copper for 4 hours. So these are just examples of copper materials. And on stainless steel for 72 hours. For example, the Apple Watch also, if you have the Apple Watch. And on cardboard, paper, any paper, and also the bill, the money. And on plastics for 72 hours, which is important because now we are using gloves to protect ourselves, and we need to wash the gloves just as we would wash our hand. The gloves collect germs, and the virus or any germ can remain on the surface for a while, for 3 days. And then in the food, can it spread in the food? Because now we are using takeout and delivery services. According to CDC, there is no evidence that the virus can be transmitted through food. It spreads through droplets. However, if you order a delivery or you have a takeout, then you may want to use gloves to remove the food from the packages, or you can use your hand and move the food throughout the package and place the food on your dishes. Remove your gloves, or you should wash your hand and don't touch your face at any point. So these are just some delivery companies who provide the service. And then I provide an example in the video of a small grocery outlet who only let people in with facial masks and gloves. However, bigger chains allow people in without mask and gloves, but they are asking customers, shoppers, to stay 6 feet apart from each other. So because of that, there is a line outside of the store waiting to get in. According to the state and government officials, you don't necessarily need to use N95 facial mask. you can use scarf or bandana to protect your face, your nose, and your mouth. These small grocery outlets may have some empty shelves, and they may experience some supply chain shock, and they have to close. Unfortunately, the bigger chains like ShopRite and Trader Joe's are able to replenish their shelves. And then in some more details, what we know about the coronavirus. Okay, so herein I just wanted to mention some other type of flu viruses. The AIDS I wrote here is not a flu virus, but I just mentioned here because it is a virus that became an endemic from the pandemic spread. We couldn't control it, and it is still circulating in the society, and we have not been able to eradicate. The smallpox was the first virus that we have been able to eradicate. So the flu viruses are, for example, SARS in 2003 from China, from bats, or the swine flu in 2009 from pigs, the MERS virus that broke out in the Middle East from camels, which is also a respiratory illness, or the Ebola in West Africa, or the Zika virus that originated from Africa, and it traveled to Brazil, where it really became an epicenter, and it originated from mosquitoes. And I just wanted to mention here the great influenza, the Spanish flu in 2017-2018, when we have not been able to travel that much at that time. The transportation system was not developed so much like now. However, the virus still were able to spread very easily, and we have been asked to isolate and quarantine ourselves to have social distancing. And now we have the coronavirus, the COVID-19, and there are some many other flu viruses as well, for example, the H5N9 and some others that I did not mention but exist.
So the next slide is the Chinese wild and exotic animal market, or so-called wet market. And the reason why this is important because this can be a place for an outbreak. The UN already placed an international ban on the wet markets because of its role of the spread of viruses. And this is where customers can buy live or dead animals, and the live animals are left in cages, slaughtered, the viscera removed, and cut in front of the buyer. And the reason why this market exists because in rural areas, low-income people are dependent on the trade of these wild animals for income source. For example, Richard Preston has a series of books on past outbreaks. One is the hot zone, and the other one is the crisis in the red zone. Okay, so when we move on, then this is a New York fish market example in Brooklyn that they are selling live turtles and frogs, and the lifestyle of these exotic animals in Chinese fish markets are already banned in California, and Rhode Island also banned it, and New York State investigated the conditions in these fish markets because of its unsanitary conditions, how these animals are left in a container, one on top of the other, and because of that, the immune system is suppressed and can shed diseases very easily, for example, salmonella. So then on the next slide, when is the virus viable and becomes inactive? The virus is not active on the temperatures above 86 Fahrenheit or 30 Celsius, and can be wiped away with household chemicals. And it can persist in the body for 2 weeks, which is good from the point of view that the body will develop an antibody against it and you will become immune. However, the virus can mutate from one person to another or to animals and then back to humans. And when it mutates, then your body may not recognize that mutated version and you become ill. Okay, so on the next slide, I'm showing an example how the virus mutated into animals. This is the first case in a Bronx Zoo. That's the virus from a zookeeper was transmitted into one lion and the other lions and 6 tigers. And it raised questions about the transmittability of the coronavirus into animals. And because of that, our pets, dogs and cats are in question that are they in danger or could become ill or maybe not. So the next slide is who can become ill, who is at risk. Mainly the older people with compromised immune system, but in general, anybody who has diabetes, lung or heart disease, or obese people. So younger people also with obesity are at risk. And so far, about 17,000 people died in the US, which is an unbelievable figure. How much the virus can mess up an immune system, and they die the next day. It is just hard to understand it. So because of the seriousness of this virus, we are asked to have social distancing and to be 6 feet apart from each other. The CDC recommended to avoid the gatherings of 500 people or more, and because of that, the St. Patrick's Day parade was cancelled, and the Broadway shows were cancelled in New York. And then the CDC recommended to cancel events of 50 people or more, and the next day in New York canceled, placed a ban on the gatherings of 50 or more. And then the pictures you see, some religious groups seem to ignore this ban, so they still gather. This is an example of a 95-year-old rabbi's funeral, and all those black points are people how shoulder to shoulder they stand to each other, very close. And in this community alone, they have 700 confirmed cases that were tested, because many cases are not tested. There is there's insufficient testing kits available. So because of this, we need to think about ourselves, our self-care. What can we do besides social distancing and to be 6 feet apart? What can we do at home to keep up and to remain healthy, to stay healthy? One is to have sufficient rest and sleep in order to rejuvenate our body and our immune system, to stay warm, drink plenty of liquids for the throat to have sufficient liquidity, not to dry out, and to use humidifier because of that, and hot shower. So the next question is there any medication or some kind of magic pill? Well, it is a new virus, so everything is experimental. There are a lot of research activities. First, they try to repurpose old drugs to see if something works.
There is no any scientific evidence that any drug, medication or vaccine works. There is no vaccine yet, and the vaccine may take 12 to 18 months to develop, but there are several research activities. For example, chloroquine, a drug that is used for malaria, or remdesivir, which is an antiviral drug, is in clinical trial, or Kezara, which is an antibody drug, which will be in clinical trial in June, later in June.
And there are some vaccines. For example, in Germany, tuberculosis vaccine is tested to boost the immune system based on zinc, but it is still in testing. Or there's research activity for vaccines against the virus itself, the COVID-19 virus. And there's also some research on antibodies to pull blood or plasma blood from people who already got infected and recovered from the virus. And they developed their antibody and to use this antibody in newly infected patients. So this is called serological testing, and also a prototype viral sequencing experimentation going on. So there's a lot of research activity. This is only just an example of the many out there, and hopefully one will work and enter the cell of the virus and can be cured. So because everything is experimental, here some doctors whom are outspoken to tell what worked for their patients. One is, for example, Dr. Zelenko, who is a doctor in Monroe, New York, used hydroxychloroquine, analog of chloroquine, based on the effect of zinc. So to target the immune system, to boost the immune system. And for him, everybody was cured in shorter or longer time. Nobody died. And it seemed to work for him with some additional treatments. And the other one is Dr. Grace, oncologist in New York at Bronx Zoo Hospital, who also used chloroquine and seemed to decrease the effects of the virus. What I want to emphasize here is the zinc in the chloroquine that is mainly boosting the immune system, helps the immune system, and perhaps lessens the effect of the virus. So because of the zinc, let's see what else do we need to boost the immune system. Zinc, vitamin D, and vitamin C. I will not talk about vitamin C because everybody knows it. So the zinc is boosting the immune system, reduce inflammation in the body, and is also a natural antidepressant. So many antidepressant drugs has zinc in it. And in order to utilize the zinc in the body to be absorbable, the stomach needs to have sufficient acid. So what can reduce the acid in the body is, for example, grains, calcium, iron, and also sugar, diabetes, and stress level. So the grain, if you think about Italians, they eat a lot of bread, pasta, grain, and also in Asia, rice. And all those things can reduce the zinc absorption in the stomach. So how can we increase this absorption is with acidity. For example, have apple cider vinegar once a day, orange or grapefruit. How do you know that you don't have sufficient acidity in your stomach? You are deficient if you have reflux or heartburn or GERD or any kind of digestive issues. There are certain food sources to supplement the zinc in food. For example, cheese, mushroom, nuts are great sources of zinc, and also spinach, avocado, or chocolates and coffee. So vitamin D. Vitamin D with calcium is well known for its bone support, but it's less much known that it strengthens the immune system also. Most people on the planet are vitamin D deficient or inefficient. How do you know that you are deficient? For example, you have back pain or lower back pain, dental issues, inflammation in the body, or diabetes type 2, then you could be vitamin D deficient, or you have mood changes or depression. It has inflammation support, anti-inflammation support properties, and also antiviral properties, and protects the lung. Who is at risk for vitamin D deficiency is the obese people, definitely, and people who doesn't have access to sun, darker skinned people who may not be able to develop sufficient vitamin D in the body, or people with cortisol medication or stressed people. So if you can't, if your body cannot develop the vitamin D from sun, then what food sources we have? For example, milk, cheese, mushroom. So for both zinc and vitamin D, what food sources do we need to consider? So milk, cheese, mushroom, nuts, avocados, spinach, coffee, chocolate. So because we talked so much about obesity, which is a risk factor for the virus, who is obese? The question. If you calculate weight per height on the square, in the US units, 703 times the weight in labels per the height on the upper script in inches will give you the BMI. If it's above 30, then you are at risk. So for testing what is available, it is also called Swabs. As of today, there is still shortage in tests available in terms of distribution and manufacturing sufficient number of test kits. And some hospitals develop their own testing kits. They are testing it either in the back of the throat or through nasal test to capture the mucus, the cell, and the fluid, and print it as 3D. Some methods requires a week or maybe a few days, and other methods a few hours. And in California, they are testing a new method which will provide the result in 5 minutes if it's positive, and 30 minutes if it's negative.
So this has a financial and economic implications. The social distancing and to be 6 feet apart from each other is basically caused a sudden economic stop, and this economic stop is not like the 2008 financial crisis that stemmed in the financial industry. The Fed only can provide relief because of that. The cause is the public health. In economic terms, this is a demand and supply side shock on the market, and the duration and the severity is unknown. We also don't know what will be the post-crisis landscape, and the insurance companies may not be paying because we need to have a fund to pay all the income loss and the additional expenses. So because of this, you cannot use regular portfolio rebalancing. It might not work, and some businesses with their liquidity issues might become solvent. And after the crisis, the capital spending may not come back. And this sudden economic stop has an employment complication also. A lot of employees lost their jobs, families cannot pay. Already 16.6 million Americans filed unemployment claims as of today, and many could not file because the telephone has busy signals, or they are disconnected, or online they get error messages. And what is important is that the unemployment benefits were extended, because otherwise they wouldn't be able to pay many people, for example, self-employed individuals, freelancers or contractors, independent contractors, and gig workers like Uber drivers. So it was really extended, and it is 50% of the average weekly benefit in your own state. And I will have some more details later on in this presentation. And a lot of families cannot pay their rent and may not be able to put food on the table and to pay utilities. So it is really a big, it has really big consequences, and it is way too expensive. So in addition to the unemployment benefits, there is also a stimulus payment for families and individuals. This is to every family and individual who filed tax return in last year. And if you didn't file tax return in last year, then the 2018 tax return is the basis of this payment. Individuals get up to $1,200, and married couples $2,400, and after children $500 to the parents. And this is based on the adjusted gross income on the tax return. Immigrants with green cards or work permits also included in this program, but immigrants without work permit are not included because their work is not needed in the US. Their profession, education, skills and abilities are not needed, and that's why they don't have work permit or green card, and those people are not included. The details is on and all the updates are on irs.gov/coronavirus. Okay, so now we move on to businesses after unemployment benefits, so relief from the government, and stimulus payment to families and individuals who file tax return. Now businesses. Small businesses will get loan, and medium-sized and large businesses. Large businesses are rather looking for bailout from the government. So here in the small businesses, it is paid by the SBA, and this loan is forgivable, but only if 75%, minimum 75% of the loan is paid on payroll to keep the employees on the payroll. And the companies need to have less than 500 employees. This is a 2-year loan with a 1-year interest rate. And you need to go to the bank and ask for this PPP program. And they will tell you what kind of paperwork you need to do to get the loan. If you don't keep the employees on the payroll, or you cut the payment, then it may not be forgivable. You may need to pay the whole amount or just partially forgivable. And in addition to the SBA loan, there is also a second stimulus package from the Fed to support the economy. And it is an extension to the small business PPP program by the SBA, but also to medium-sized companies with employees less than 10,000. And this is a 4-year loan, and in the first year the principal and the interest is deferred. And then we move on to insurance. The sudden economic stop that requires some relief from the Fed and some stimulus package also created some legal problems and insurance problems, because these companies who's been asked to stop their activities and individuals who asked to stop their activities have insurance policies, and they are looking to the insurance companies to pay their cost and the lost income. However, there are 2 insurance policies that are in question here: the business interruption insurance and the civil authority insurance. The business interruption insurance has a clear exception against epidemic, pandemic and virus related causes. So the insurance companies will not pay or may not pay. And the other one is the civil authority insurance, when the government or the state prohibit the person or the policyholder to enter the property, and this created income loss or create an additional expense on the policyholder, and they are looking to the insurance company to pay this loss or the expenses, for example gas leak or explosion. But this also has an exclusion against pandemics. So it is questionable that the insurance companies will pay. On the next slide, the picture basically depicts the civil authority insurance when there is an explosion and the government moves in and prevents the policyholder to enter the property, and this creates an income loss or an expense. So here are basically 5 parties in a battle. One is the policyholder who wants to get paid, and the insurance companies who says no, there is an exclusion against pandemics and virus related claims, and the regulators who support the insurance companies because there is an exclusion, and the policymakers who ask to have available fund to pay out to the policyholders and to undo these pandemic exclusions, and the legislature who support the policymakers to undo the exclusions. So this battlefield is in the courts in 4 states. in New Jersey, Ohio, Massachusetts, and New York. New Jersey already accepted that yes, there is an exclusion, pandemics are not included, so the insurance companies will not pay. On the other hand, the other 3 states are still in battle in the courts, and we shall see what the courts will say. The insurance companies fight on the basis of 3 counts. One is that there is exclusion in the policy against pandemics, and second, there is also a war clause between the policyholder and the insurance companies, that the government, state, or a third party cannot come in between the parties without both parties agreeing it. And third, that to undo the exclusion or a rollback on the exclusion is unconstitutional. So we need to think about now, consider about that, is this sudden economic stop which created so much damage is a national issue or not, and public health is a national issue or not, which will have a Medicare consequences, a Bernie Sanders Medicare for all consequence. And what can we do now retrospectively, and what can we do looking to the future proactively? So this leads to the legal matter that the insurance companies and the courts are looking into the legal complications, that the civil authority of the government and the state to ask companies and individuals to stop their activities is constitutional or not. And they declared war, and the question is there really a war or not? So the courts will have a say on that. What we see right now is that there's a high demand for counselors and lawyers to guide people through this pandemic. Texas already have set up a free hotline, a free legal aid hotline, and other states did it on a website, online, regarding bankruptcies, because some businesses from liquidity may move to solvency. The unemployment legal complications or medical claims regarding some test costs have to be paid, and the quarantining have some legal rights issues. Child custody, foreclosure, mortgage forbearance, and bondholders, because some tenants may not be able to pay the rent and the landlords need to pay their mortgage and the bondholders are crying out. So there are a lot of legal complications, and the landlord-tenant issue and public benefits issues. So this leads to the legal matters on employment, and specifically the workplace legal issues. For example, safety, privacy, and legal policy, and the sick leave, medical coverage, self-quarantine orders, quarantine legal rights, unemployment benefits. Here in the picture is the supplemental unemployment benefits. And regarding safety, I just would like to mention that some hospitals and medical centers, for whatever reason, not allow nurses and aid workers to wear facial masks and to use PPE, personal protective equipment, which creates an employment legal matter. So the civil authority of the government and state to ask businesses and individuals to stop their activities was ordered, and 9 states did not follow these orders. These 9 Republican states defied these orders: Arkansas, Iowa, Nebraska, North Dakota, South Dakota, and partial restrictions implemented in Oklahoma, South Carolina, Utah, and Wyoming. So why did these states defy the orders? They say that misleading illusion, because people will still go out in public. I cannot lock the state down. People have to be responsible for themselves. He's listening to advice to his own experts rather than to national health officials. Questioning the necessity of a statewide order. State and national constitution prevents us from taking draconian measures, much like the Chinese government has done. And President Trump says that I leave it to the governors. The governors know what they are doing. And this national health official in charge at the White House is Dr. Anthony Fauci, who is a very respected physician and immunologist. He is the lead of the White House Coronavirus Task Force, a physician of the National Institute of Health, served as the director of the National Institute of Allergy and Infectious Diseases since '84. And he has recently said, quote, "It is likely the virus will assume a seasonal nature because it is unlikely to be contained around the world this year." Do you remember at the beginning of the presentation when I said if the virus cannot be contained after its outbreak, then it becomes an epidemic, and if it cannot be contained, then it becomes a pandemic, and if that cannot be contained, then it becomes seasonal. And this is what Dr. Fauci is saying. So this leads us to the conclusion and final thoughts with some concerns and what solutions might lie ahead for this pandemic. To develop a platform to create new vaccines and drugs fast and quick. And here I just want to emphasize the platform, and to create a universal flu vaccine, because we cannot have a vaccine in every single year. It has to be universal to enter the cell of the virus and to prevent the disease from spreading. And we also need to have a much better diagnosis for viruses. There's a lot of misdiagnosis of flus. And to develop a surge manufacturing capabilities to manufacture and distribute the testing kits, Swabs, fast in the whole nation. And what I want to also emphasize that we are responding to an event rather than preventing the event. And it should be really the opposite, which can mirror also the Medicare. The Medicare costs are really very high. We are responding to a disease, and I do believe that we should pay much more attention and more investment in the prevention of diseases. And in terms of law, it has to be consistent for every single state. And need to consider that public health is a national security health or not. If it's a national security health, then Medicare comes in question, and Medicare for all or not for all. And can the government enter one's property and to spray around to prevent an outbreak, for example, and to ask individuals to vaccinate themselves without their acceptance? It stems in the national security issue or not question, which has a constitutional rights and legal or legislative matter consequences. So in the next slide I summed up some concerns. I'm not sure this complete economic shutdown is the answer to this pandemic. It is way too expensive. It's like a drop in the bucket, and we need to pay way too much price for it. And the next concern is really for the science. Why one person die in this virus and another do not? Even if they have the same risk factors, this virus can mess up one person's immune system so much that it may die in the next day, and another person can work it out, or don't even have any symptom. So it's really the science who need to answer, because so many people died in this virus that it is just really heartbreaking. And the other issue is that why this virus has hit so much African Americans. So it's race related. And next is public health a national security issue or not, which has a Medicare relation, because if it's a national security, then Medicare and Medicare for all comes into the picture. If it's not national security issue, then the civil authority of the government to come in and demand a sudden economic stop is also in question in terms of constitutionality. And at the end, I just would like to comment that as the health gains are coming back and the market may start rising already as the common wisdom of the market, We may have reached the bottom, but we shall see if it moves through states and it becomes rather a U curve and not a V-shaped curve. Hopefully we already reached the bottom and we are moving upward and we can reopen the market. Thank you for your interest. I hope you find this information useful. And stay healthy, stay safe. Bye now.